All right. Hello, and thank you for joining us for today's session. This webinar is part of our Capital Conversation series, where we provide a unique opportunity to hear directly from key policymakers, leading experts, and of course, the Lutheran Services in America staff about the latest policy developments and their implications. In this session, we will highlight what we are expecting for the first few months of 2026 as Congress gets back to work. We'll discuss what's ahead for Medicaid, appropriations, workforce, and health and housing issues. Our advocacy team will also share a brief update on current federal policy priorities and key developments in Washington, D.C. that may impact our work in the months ahead. So today we've got some very special guests that we're delighted to introduce. We will hear from Eileen Stein, who is Vice President of Government Affairs at the Center of Budget and Policy Priorities. Luis Zaldivar, who's the project director at the American Business Immigration Council, and Andrew Fuller, program director for economic policy at the Evangelical Lutheran Church in America. We are thankful that they have been able to join us today and are looking forward to having hear their valuable national lens on these issues, offering insights into emerging, hopefully not emergency, policy trends and what they mean for our sector. First, I'll turn it over to you, Bill, to provide a framework for our discussion.
Thank you, Alicia, and thank you for joining us and welcoming to you today for our webinar. Just want to remind everybody this is an interactive session, so please put questions in the chat for our speakers and for us, and we'd love to be able to get the most out of our presentations. But before we get started, we have a couple polls that we'd like to ask, and I'll have Kylie open the polls here for us. The two questions that we're looking for is kind of as we prepare for today's presentation, looking to find out where people are weighing in on their congressional priorities as it relates to Medicaid, the appropriations, workforce, and health and housing. And it looks like right now from the poll, we have a little over half that have a pretty good understanding, and we have some people that have some limited basic information there. So I think we'll learn a lot here in the next hour. The second poll question we have is, we have three main priorities that we've identified as Lutheran Services in America, but also through our members and our policy committee on Medicaid, workforce, and health and housing. And we asked people what was most important to them. And of course, Medicaid out of the 20 people, that's pretty high. Health and housing still continues to be pretty high. And then workforce is the third. So thank you, Kylie. All right. Kylie, can you share my screen or share the PowerPoint? I'm just going to give a quick update on some things that are happening federally that we're tracking, but I want to remind people that they can find all of this information in our Capital Communications. We had one come out at the beginning of the week, and then with some things that were currently happening, we provided another one at the end of the day yesterday, and even some of the information we provided at the end of the day has changed. So I just want to give a brief high-level update, and some of this will be reinforced and go into deeper level in our conversation with our presenters. You may have been alerted yesterday that there were many organizations that received letters that some of their behavioral health and mental health services from SAMHSA, over 2,000 grants were they were issued that they were not going to be no longer recognized, totaling $2 billion. This morning, we received news that both of those, that the administration had rescinded that plan and they reversed their perspective on that. So we're still following that with some cautious optimism that we continue to address the mental health and behavioral health needs of people throughout America. I know that advocacy was really lifted up by both legislators, the providers that were affected, and the families that were affected. So that was some quick changes there. Second thing I want to point out, this is a little, we'll go through this today again, but the reconciliation package, just recently there was one released, a second reconciliation package. And in that package, it did propose $1.6 trillion in cuts around overall, but it definitely had some cuts for mental health services. There are some major hurdles that the House has to go through. One, they do have a simple majority or minority, so they'll have to get that passed. But there is some interest in the language that's within the bill, so we're watching that carefully. Also want to talk a little bit about the State Department. They had halted some immigration visas over 75 counties. We still see that as a challenge for our workforce challenge. It also affects people as they're looking at the determinants of their access for health, to receive services that are definitely tied to the safety net for some of the staff that are from those counties or countries. And then finally, the latest in Medicaid changes. We know that recently CMS has sent out their initial guidance for HR1, really specifically to workforce. And we know that Nebraska has been kind of leading the way as the first state to issue their challenge or their perspectives on workforce and how that's going to affect the people that are on Medicaid. But many states and providers are waiting for more clarity around that from CMS, from the financial perspective, the technical issues, how they're going to implement that, and then also just the next steps and how that's going to affect providers. So those are the larger pieces that we're kind of tracking. Again, you can get into a much deeper dive on some of that information in our Capital Communications. And if you're not registered for that, let myself or Kylie or Sarah know. So it's
Thank you so much, Bill. Thank you so much, Sarah, for inviting me, all of the team here at Lutheran Services. I am really pleased to be here. I am with the American Business Immigration Coalition. We are a network of employers that has been advocating for immigration reform for a few years now. For quite some time, our focus was in agriculture. We got a bunch of farmers with us. As you can imagine, farmers are really concerned about immigration. We have been building up other sectors in the last couple of years to finally make it to long-term care, which is the reason why I connected with all of you. I thought that I had the most difficult job in the world until I hear Eileen's presentation. My hat is off to you. You know, clearly we are living in a situation, a very complicated legislative world where nothing seems to be moving and things are changing all the time. So with that being said, I am going to try to do my very best to explain to you how is it that we're seeing the current situation, what are some of the bills that we see, you know, as potential solutions, and what are some of the things that the employer community in general, the long-term community in general, should be keeping in mind in the next couple of months as we are likely to continue to see a very, very, very strong enforcement situation happening. I don't have to tell any of you the situation about workforce because you all are already aware that a lot of the facilities are short-staffed, but it is important to remember that it's about 20% of the entire workforce on long-term care is immigrant, and that includes about a third of them who are non-citizen immigrants, right? People who don't have currently a citizenship but have a valid work permit. And that is another layer that I really want to clarify to start off. Anything that we're talking about today is about people that currently have legal work permits. We are not talking about the undocumented, even though that is something that our organization would also like to see fixed, and some of our people in our alliance. But today we're going to be talking about folks that have currently a work permit, but are at risk of losing that work permit because of the current policies. In particular, in home care is where we are mostly seeing employers telling us that they have a lot of immigrant workforce, especially TPS holders, temporary protected status, that they are very much worried about. So, as I imagine all of you know, your facilities and your employees, it is clear that we need to find a solution for all of this, because it is just unpractical to think that all of the industry is just going to be able to move forward, without that 20% workforce. And that is why we have been talking to a lot of legislatures to see what is the best path forward. Up until the election last time around, there was a sense that any solution needed a path to citizenship, right? That was the overwhelmingly consensus in the press, in the Democratic majority of the time. Since the election, that has changed. We are seeing now as a crisis, and we want to find a solution short term that we can at least protect the people that are currently working in the facilities before moving forward. It's in that aspect that there are a couple of bills that I would like to bring to your attention. One is a Healthcare Workforce Resilience Act. This is a bill to recapture unused visas of nurses and physicians. And these are visas, that are currently have been put out but haven't been used. So this is a way to recapture those visas. We really like that bill, but for your purposes, it's just a drop in the bucket, right? We're talking about 25,000 visas, about 25,000, which is not nearly enough. Then there is the Strengthening Our Workforce Act, which provides specific visas to industries like home healthcare, but it's only a 2-year conditional status. And that also is a little problematic because, as all of you know, training takes time. So if you hire somebody and they have to leave after 2 years, it doesn't really make much sense for any of you to hire somebody with that visa. And then there are two bigger bills that will fix a problem for you, for us, and for everybody else. One is so-called Dream Act of 2025. It has a companion version in the House, etc. It was reintroduced again last year by Murkowski, the Republican from Arkansas, Alaska, and Durbin. And this bill basically will fix the situation for the dreamers, people who came here, when they were underage. And the other solution is the Dignity Act. The Dignity Act was introduced originally in 2023 with a path to citizenship, and last year was reintroduced without a path to citizenship. And that is a bill that we are championing the most because it will cover all of the industries. And basically what this Dignity Act does is provide a new status called Dignity that will basically capture all of the current visas. So if you know anything about immigration, you know that currently there are like 20 ways to get into this country or 20 ways to get a work permit, and that is what makes it confusing for the employer, for the employee, for the news, for everybody. And the Dignity Act will create a new visa that is the only visa called Dignity that will give people work permits for 7 years, and they have to pay a fee. It's $1,000 a year. They have to have a clean criminal background and a couple other conditions. So what is the status of all of these bills? Well, the status is that every person that we have talked to about this in the Republican majority, in the current Republican majority, they agree with all of this. So we don't have to convince anybody on the merits. Everybody says like, yeah, that's cool. We secure the border already, so let's secure the workforce, right? And that is something that has resonated a lot. And I encourage you to use that language in conversations that you have with representatives, that if the problem was about the border, there was already a bill passed about that. There is massive enforcement happening. There is negative migration right now. So there is no border to be worried about, but we have to worry now about the workforce. And that is a message that again has resonated. But they also tell me immediately after that they need the president to green lights the solution, right? They want the president to basically say, go ahead, we can go with this. So we have sent a message to the White House through all of our network. We have gotten the president to say multiple times by now, including just a couple of days in the New York Times in the really long interview that he did, that he again says that, yeah, if the Democrats are done with this, we will support an immigration reform bill that will take care of this. Uh, so so that is good news, right? The president is saying it, the Republicans are saying it. So what is happening right now? Well, it is a political momentum, right? In our consideration, the closer that we get to the midterms is the farther that we are going to be from any kind of solution, because then the Democrats will encroach, right? And they will say, well, we will not vote for anything until the midterms, which is exactly what the Republicans did last time, right? And we also see a divided government after the midterms if the Democrats win as another complicated situation for us, because there will be no reason for any of the sides to move forward. So we have a window from now until maybe September, well, maybe a little before that, that we can try to push any of these bills forward. I am here to thank you all for being aware, for trying to engage on these issues. And my hope is that after this conversation, we can in the future see any of you, taking this message to your representatives. So Bill, Sarah, everybody, if you have any questions, I'm here for you. Mhm.
Thank you, Luis. That was great. There was a question in the chat. They wanted to get a list of the bills that you presented on. So if you wanted to provide that to myself or Sarah, we can make sure that that's listed when we send out kind of the follow-up on this meeting. I think that you kind of hit on this, but when you look at the work that you have between now and September, where do you see hope, or where are the bright spots that we can focus on?
Any purple state Republican, right? Mike Lawler, Jimenez in Miami, Fitzpatrick in Pennsylvania. These are all Republican representatives who have already publicly said that they want to see a solution, that they want to see a bill. Of course, they have selfless reasons, right? They want to win re-election. So those are places where I think we can move forward. If any of you have connections in California or in deep red areas with a lot of agriculture, these are also areas that want to see a solution. So there are people out there. Again, everybody seems to also want the political moment to shift, right? So that is the bright spot, is that everybody seems to agree on the policy. What we still have to agree on is in the politics.
Thank you, Luis. One thing that I hadn't thought of that I was reminded of is that the bills that you did speak about are on our public policy advocacy points for this three. Our third one being workforce. So all of those are listed there, but we'll also have it in the communication afterwards. There's another question about the Dignity Act. Would visas such as T and U visas be impacted? Those aren't work visas since they're victims of crime. Would that mean they would have to work to get a visa now if that passes?
No, I was referring to all of the work related visas. My understanding is that victims of crime will still have a separate path.
Great. Well, thank you so much, Luis. And again, really appreciate the information. We're all challenged by this, both by our workforce, but also a lot of the families we support. So it provides us resources to be able to help them as they navigate the current, and it gives us some areas to advocate around as well. So thanks for your time. Now I'm excited to turn it over to Andrew. Andrew, thank you for joining us and provide us a little more information on housing. I know you cover a lot of other things as well, so we appreciate your time.
Yeah, for sure. Thank you, everyone. I'm going to repeat some of what Eileen sort of said just to flesh things out a bit. And also, I'm going to ask for some favors because I can be cruel like that. So, the first thing I wanted to really touch on is to just re-articulate that there's not going to be a lot of bills that pass this year. And one of the last major vehicles is going to be this end of month appropriations series of mini buses, right? So, if you have policy asks, this is sort of the vehicle to get them done. While stuff will be happening later in the year, it's going to be scarce. So one of the requests that I'm going to be pushing is Eileen sort of hinted about greater cost share starting to phase in later, starting at the end of this year for SNAP at least. And I just wanted to flesh that out in some links specifically. I'm going to drop a lot in the chat for a minute. But just so folks are aware, the first major cost share phasing in is a SNAP administration phase in starting in November. And why this is important, well, this is a hunger issue, and you might say, like, what does this have to do with housing and healthcare? If you actually look at the burden that states are going to be expected to start paying into the federal government, this is going to really delve into their federal budgets deep. Many states are going to have to pay millions of dollars extra, and this is just starting this year. And if Congress doesn't include a fix to this in this end of month package, they could feel pressure to do this later in the year, but it'll be too late because states are already working on their budgets, and it's many of them who are already in these really deficit-prone areas might feel pressure to cut things like Medicaid, community home and home-based services, right? Or other optional features that they have spare money for, but now they need to find some way to pay for this extra cost share. So in the chat, I dropped some resources of the state-by-state breakdown of how much different states are going to be owing, as well as a list of our state public policy map. We have Lutheran state directors who work on the state budget across the country. If you have one in your area, please give them a call and say, like, thank you. And also, if there's any way you can help, because whether or not Congress can fix this or not is going to be sort of up in the air. And if they can't, then working with states directors to make sure that Medicaid services are protected is going to be huge. So the congressional ask, just so you know, is asking to at least delay the SNAP administration fees at least 2 to 3 years, right? So that states have more time to find this money, to correct their error rates, to reduce the burden on their budgets for now, and to basically minimize the costs. That's S1. We also sort of mentioned the COC program Eileen did before shortly. That is the Continuum of Care program, which is the largest source of homeless funding. I know some of you also work on permanent supportive housing. This is also where a chunk of that money goes. At the moment, there is this sort of limbo status with that homeless grant funding where normally, we're supposed to be in this now 2-year budget cycle for homeless funding. So in theory, applicants shouldn't be reapplying this year, but late last summer, the new administration announced plans to basically offer a new round of funding notices or applications early. The consequence of this could be because that funding notice came so late and providers need to reapply on a very, very late basis. It could mean that there's several months of just like open space where like there is no money going out the door. The National Alliance to End Homelessness has estimated that if this goes through, it could mean up to nearly 200,000 people go back on the streets. That's nuts. So what we are asking for is for Congress to, one, honor the existing 2-year cycle. The THUD spending budget is supposed to be coming out this weekend. So calling your members and saying, please insist to HUD that you honor the 2-year cycle and have really strong language that insists on that issuance is pretty important. It sounds like, and Eileen might get the suspicion too, that text might be in there, but we really want to insist to Congress that it happens. If Congress doesn't do that, there is a current case, a court case, challenging this late notice of funding change. And at the moment, this rule is frozen until that court case can proceed. So at the moment, like this plan isn't like going forward. HUD is supposed to be honoring the current structure as it is before this change. But if things go south, we want to make sure we're covering our bases and that we don't cause this massive homeless crisis in the middle of the spring. Finally, I just wanted to flag that there are some other housing opportunities that might be coming up later this year. Some of you who are more addicted to Twitter or Truth or whatever social media platform you follow might be seeing that the president has been talking a lot about housing lately. Just the other week, he mentioned this potential ban on companies like BlackRock from buying single family homes, all these other like proposals, putting pressure on the Fed to do more on housing affordability. It's expected later next week when he goes to Davos, Switzerland for the World Economic Forum that he will be announcing some sort of housing plan. So we'll be looking forward to seeing what he actually has to announce there, specifically, concretely. In the meantime, many of us have, and with Sarah Dobson and Sue and many others on this team, have been working on the Bipartisan Road to Housing Act, which a bipartisan cohort of members are hoping to pass this year. If you believe Elizabeth Warren's tweets, apparently Trump announced his support for this plan as well. So there could be momentum to get something like that done later this year as well. Um, Either way, there seems everyone's going to be talking about affordability. Everyone wants to talk about some sort of housing supply expansion. And so, what that is specifically, there's energy behind at the moment. And I sort of will leave it there since I went through a lot.
Thank you, Andrew. I think it's kind of a comment in the question, but there's a maybe some that you want to answer as well in the chat. It says linking all potential cuts and fees equates to threats on housing. Keeping people housed is basic to keeping their systems functioning. As you know, it's essential. Um, Healthcare and housing are so interconnected, and I think that you laid that out really well. Do we have any additional questions for Andrew around that? He's also well versed both in Medicaid and also some of the processes that Congress goes through for funding. So maybe Sue's coming online there for a question. Maybe not.
Well, there is a question in the chat, Bill,
Yeah.
from Heather. She's asking about the estimate of people who could be homeless from the new notice of funding opportunity. Andrew, do you have thoughts on that?
Maybe just put what the National Alliance put in the chat. I'll just put it in the chat. I think their estimate was 170,000. Uh, which is not basically there would be several months of a gap period, right, where there's just no money going out the door anymore, right? And so I think while some providers might be able to find some gap funding or something, I think in their calculus that's the figure that would probably be forced back onto the street. And this is just to say, even if you don't rely on continuum of care funding, when any large spike in unsheltered homelessness comes out, if you have other housing services or feeding ministries or other things like that, you probably see a notice of that echo effect, right? So this is just to say we want to avoid that situation by any means possible.
Yeah, and Andrew, while we have you, just I think Louise and Eileen both spoke to this a little bit, but is there anything you're seeing as hopeful on the Hill? You were pointing to some of the bills that we might see coming down the pike. I know Slotkin from Michigan just introduced an emergency housing bill. Like, are there things that you think are more hopeful potentially as we get later in the year?
Yeah, well, I think everyone wants to put their mark on housing. It's just going to get more and more challenging as we get closer to the end of the year. It's so early at this point, but there could be a big window to get a lot done after the elections in November. There could be just this backlog of, there's a ton of retiring members happening right now, right? And a lot of people are really like sort of locked and not wanting to do much before the election. But afterwards, there could be people who are exiting who are just say, I want to leave this as part of my legacy. And there could be a big window to get stuff done there. So even if you don't see something happening in the immediacy, like just like preparing for that last 2 month session could be a really busy series of months. Which is a good thing, I think. And I think a lot of people are going to want to sort of leave the Congress with like a good legacy on their back.
Thanks,
Thank you.
Andrew. Go ahead.
There's one more question in the chat there. I think this is a really good question for advocates and for organizations that are setting their priorities. We get a lot of information. Like you said, you're following so many different formats for media and questions. And how do you keep focused on your own priorities? We've had a lot of conversation about that internally as well. So interested to hear what you'd have to say on that.
Well, I mean, like a lot of my impact at least comes from what Lutherans say is they're experiencing, right? So like there are often are hunger programs and stuff where it's like it's not making a lot of headlines or news, but if that is like what is like if like USDA, the Department of Agriculture rescinds like a small program and that's ma a major like disruption in supply chains, that it doesn't matter if that's in the news or not. That's what I focus on, right? So. I would say like the more feedback, we get from providers like you and stuff like that, that's what shifts my focus. And frankly, it doesn't matter what, Congress is like a river, it will go where it wants to go, right? But like really making sure that we're prioritizing the areas that really make an impact on poverty and our mission, I think is where I really, it gives me focus on what Lutherans care about specifically.
Thank you, Andrew. And I guess I would bring that question up to Eileen and Luis if they're still there on camera, if they had any advice for organizations as they kind of keep their eye on the ball and keep their priorities out there. How do you help decide on your advocacy points and keeping an appropriate perspective and not reacting, I guess, to each tweet?
And I
Thank
will
you.
go with two things. One is that we are living unprecedented times in many ways in politics, and that allows for unprecedented things, right? Maybe we can do things differently because things have been going different in the last year or two. Yeah. And the second is that organizing these kind of things is all relational. And the people who are making the decisions also have relationships. So getting to the people that have those relationships changes everything. One person that has a really close relationship with the legislature is more important than 3 million people screaming online. And those are things that this particular group of people here have more leverage on because you have the expertise and people will listen to you about these things.
Thank you, Louise. That was great. One of the things that we've been working with as a association membership group is that just connecting the legislative priorities that are happening at the federal level to the state level. And I think that's a great example of there are people at the state level who have significant relationships with people at the federal level, and there's a chance for us to make that connection between your state senator and your federal senator, those types of things, but also the personal ones that we have as well. I think all three of those that Andrew and Eileen and Luis provided a really good roadmap for us to prioritize and work on. And I think that our priorities hopefully are reflective of our members' needs and the people you're supporting. So I just want to take a second to thank Eileen and Luis and Andrew for joining us today and covering in 30 minutes or in an hour covering housing and Medicaid and immigration is not a small task. So thank you so much. Before we leave, I want to thank everyone for joining us today. And we just have one closeout poll that we'll share here. And we'll see where I think it's coming. There it is. And the poll is, again, same as the beginning, is how would you rate your understanding after today's presentation on Medicaid, appropriations, workforce, and health and housing? Well, thank you, everyone. It seems like we've increased a good understanding and the basic understanding. I just want to remind people that our capital communications that came out this week, along with Chris, does a great job on our team of kind of capturing what we talked about today, and we'll send out a reminder. And it can give you a better understanding or a deeper understanding of what we're giving pretty at a high level. It's to cover this much material in the time. Want to make sure that people are kind of given opportunity to look at those links. I know Andrew provided a number of links, and I know that Eileen has some as well for us, and that will be part of our presentation as we follow through there. So thank you for your time and appreciate you attending.